So hello and welcome you all to Sail to MDS Dental Academy. So as our journey is going very smooth, almost we have uploaded near 8 videos. The previous video was about quick revision and was liked by many people. Thanks to that. So friend, please, before watching any of my video, read the description box below and please like, share and subscribe, because I told in my first video that you are my virtual audience. I will get to know by your comments, by your views, by your likes, so that inspire me to do my work continuously. And also now we see the on-demand lecture. That is based on the composite. This lecture will be useful for MDS aspirants, BDS students and also for the clinician, as sometimes when we use the material we should know the basic science behind it. So friends, let's get started with the composite. Today that will be a part 1 in which the things associated with the composite will be studied, like etchant and the bonding agent, and in part 2 will be composite in detail. So friends, let's get started. So now we will study regarding the acid etching. Acid etching was first revealed by Buonocore in the year 1955. He used 85% of phosphoric acid. The concentration he used was 85%. And later Silverstone has told that the optimum concentration of acid required is 30 to 40%. Okay. So now we will study how this acid etching occurs. Whenever you are etching any enamel surface, remember the enamel KO margins should be beveled or chamfered. Why? When you bevel or chamfer any margins, the surface area increases. If surface area will increases, the area for the etching will also increase. So that improves the seal, retention and thus reduces the micro leakage. And in the way you will get your satisfactory restoration. So when the enamel has been etched with a 30 to 50% of phosphoric acid, it roughens the enamel surface and forms a microporous layer of 5 to 15 micron. Okay. So properly acid etched enamel surface appears dull white and chalky. So you can see in this diagram how the etched enamel rods appear and how the unetched enamel rods are there. Okay friends. So now we'll deal what are the etching techniques. There are 3 etching techniques. The first is total etch. In that 30 to 40% phosphoric acid is used. Okay. And then rinsing has been done. The advantage of this technique is increased bond strength to both enamel and dentin. But the disadvantage is post-operative sensitivity. So self-etch technique has been devised in which the low concentration of acid is used, like 10% malic acid. Here the post-operative sensitivity is reduced, but there is also decrease in bond strength. So nowadays the most commonly followed technique is a selective etch technique, which I will explain in detail in the following slides. Remember, here I have written something that is a gluma. Gluma consists of glutaldehyde and hammer. This gluma is a desensitizing agent applied on the surface for a period of 1 minute. Okay friend, so as I have told that we have to use certain concentration of acid. Imagine if you are using the more concentration or less concentration, what will happen? If concentration is greater than 15%, then monocalcium phosphate monohydrate will form. If concentration is lower than 30%, the dicalcium phosphate monohydrate will form. This both will interfere with the adhesion. So recommended concentration, that is 37% phosphoric acid, is to be used. Then next question, what happens if enamel is etched for a longer time? Okay, sometimes what happens when we do the patient, we keep it, let it get etched, that will improve the strength. But no, if you etch the enamel for a longer time, the deep areas of etch will form. Okay, and then when you apply the bonding agent, they have a high viscosity, so that bonding agent will not able to penetrate those deep areas, which in turn results in a dead space beyond that bonded area. So whenever that enamel will bend or a weaker bond get break off, this dead space will expose to the oral fluids. which will result in the formation of secondary caries or discoloration of your restoration. Okay, then one more question we can say, the etching of deciduous teeth requires more time. It is a myth. Latest generation, the recent article says that etching of deciduous teeth and the permanent teeth require same time. Previously it was thought that because of aprismatic enamel, deciduous teeth require more time, but that aprismatic enamel is only present at the cervical area of tooth. So both require same time. But my friends, whenever such question is asked in the examination, so remember, if you want to crack AIMS or NEET, focus on the question, what it has been asked. Okay, if a question like a true or false has been asked that etching of deciduous teeth require more time, yes or no? No, it does not require more time. But if question is asked like this, the etching of deciduous teeth require more time because of what are the reasons, then you have to write the aprismatic enamel. Okay, and friends, such questions are very important because nowadays they are asking clinical based question. So focus on each and every point which I am telling. Here you can see certain abbreviations are given like a BIS, gamma, HEMA, TECH-DMA, TG-DMA. Remember their full form. The BIS gamma is also known as a bone resin. Okay, what are these? They are unfilled resins. Okay, they have a higher viscosity. So in most of the composites, previously BIS gamma and HEMA are to be used, but nowadays they have added it with TG-DMA or TECH-DMA to reduce the overall viscosity. So now dentin bonding systems. So whenever we want to bond dentin, there are some problems associated with it. Why? Because of its composition. To bond enamel, it is very simple because enamel consists of 95 to 96% of inorganic substance by volume, whereas the dentin in turn consists of just a 50% of inorganic substance by volume. That makes the dentin bonding little bit difficult. So what the dentin bonding system consists of? It consists of all these four things, not only bonding agent, it consists of etchant, conditioner, primer and bonding agent. So etchant we explained before. So what is conditioner? The conditioner removes the smear layer and etch the intertubular dentin and form microspaces. So this primer, that is a wetting agent, it improves the bonding of those microspaces. Okay, and the bonding agent we know it's an unfilled resin that bond the composite and the tooth surface. Then what type of dentin is required for bonding, whether moist dentin or dry dentin? Okay, so you can see in this diagram the moist dentin. What happens when the dentin is moist? The interfibrillar water acts as a plasticizer that opens the dentinal tubules and allow the monomer to penetrate inside. So here you can see how the tubules are open, and here you can see the increased thickness. So what happens when the dentin is a dry or a desiccated? There will be the water loss and a collapse of collagen fibers that will not allow the proper penetration of the monomer. So remember, the dentin should be moist. If the dentin is wet or it's over wet, what happens? The water droplets present there will compete with the bonding to go into the collagen network, and that results in weak bond. Okay, so now how the bonding take place? Remember, this dentin bonding agents have a two end, hydrophilic end and the hydrophobic end. This hydrophobic end will bond with the composite and the hydrophilic end will bond with the dentin. So in this way the dentin bonding agent acts as an interface between the composite and the dentin. So what happens when you apply the bonding agent on the etched enamel? So etched enamel, we know they have microporous layer. So this bonding agent will flow in that microporous layer and form a text that results in a bond. Okay friends, so now we will focus on the dentin bonding agents. They are also known as adhesives. We classify based on number of things, but certain important classification are there that based on number of steps. Can be a 3 steps, 2 steps or a single step. Based on generation, it can extend from the first generation to the 7th generation. It is based on their chemistry and what they do with the smear layer. So we will see now the clinical steps involved with each generation. This is very important from exam point of view. Remember, the first and second generation, the number of steps required are 2. In third, fourth generation, the steps required are 3. In fifth generation, 2 steps are required. 6 generations are of 2 types, type 1 and type 2. In type 1 you require 2 steps and type 2 is a single step. And 7th generation is a single step bonding agent. So what are some important points of bonding agent, or in other words we can say how this bonding agent get evolved. So this first and second generation bonding agent is based on the adhesion to smear layer. Here there is no acid etching of dentin, and the agent used here was a simple citric acid, 25% citric acid was used. So this first and second generation bonding agent, they have very low bond strength, somewhere about 2 to 6 megapascal. So research has been done and a third generation bonding agent was formed. This third generation bonding agent tend to remove the smear layer, but then also the bond strength was not satisfactory. So the fourth generation bonding agent was devised. In that, the phosphoric acid was used as an agent, and here the concept of hybridization, that is a formation of hybrid layer, was introduced. Okay, but here also the bond strength was near about 8 to 15 megapascal, and it was multiple steps, so time consuming. So research has been done, and fifth generation bonding agent was formed. The fifth generation bonding agent was just 2 steps, so it was not that much time consuming. Here the one bottle system is used, that is the primer and adhesive was there in the one bottle. You can see here the example of the fifth generation bonding agent. Okay, so the fifth generation bonding agent was good. The bond strength was somewhere about 18 to 22 megapascal, but the problem is that there was a post-operative sensitivity. What happens that we use agent in this, so because of that this agent was too strong for the dentin. So when this acid etching was done, it will remove the smear layer and the smear plugs get open, which increase the sensitivity. So yet more research has been done, and they come to a conclusion that now we will not remove the smear layer. Instead of that, we will modify the smear layer. So from 6th generation, the concept of etching was removed, and they modify the smear layer with the help of acidic primer. You can see here the example is that they used to apply the acidic primer. So the results were satisfactory. The post-operative sensitivity was reduced, but the bond strength was very less with enamel. Okay, and then in 7th generation was almost similar to 6th generation, only the point was that it was single bottle and fluoride was added. So you can see the 5th generation, the problem was post-operative sensitivity. In 6th and 7th generation, there were 2 problems. The one problem was the bond strength with enamel, and the second problem was the decreased shelf life. Because of this acidic primer, the shelf life was less. Okay, you can see here the example of 7th generation bonding agent, that is a I bond. So what to do? So what is the ideal bonding agent? It depends on your requirement of restoration. If only enamel is there, you go for the acid etching with phosphoric acid and then apply bonding agent, done. If only dentin is there, then here no etching is required. You have to go for the self-etch adhesive. Okay. If enamel and dentin both are there, then you have to follow the selective etch and bond technique, most widely followed nowadays. And also in clinics also, please take care that which type of bonding agents you are using. Okay. So follow this technique, that you have to etch just enamel, then rinse it with water, then apply self-etch adhesive on the dentin. Okay, then blow air until it gets dry. So friends, the selective etch and bond technique was followed. Here the advantage of both bond strength was there and also reduced post-operative sensitivity.